Some long-term effects of COVID-19 are still unknown. That's one reason state lawmakers are trying to find ways to deal with the virus for the years that are ahead of us. Experts say the people with long-haul cases could have health issues in their bodies and brains for an extended period of time. Fox 40 Capitol reporter Ashley Zavala explains what healthcare providers are struggling with and what patients are demanding.
Preparing for long-term COVID-19 cases in California is a big project ahead for state leaders. The state Senate committees on health and pandemic emergency response work to figure out where to even start at its hearing Wednesday.
It's imperative that we now start to give rigorous attention to understanding and treating long COVID in the months and years to come.
Experts told lawmakers long COVID creates ongoing problems for people physically and mentally. Dr. Stephen Deeks with the University of San Francisco said some of the sickest patients are those who got infected in the first wave of the virus, with still so many unknowns with the latest Omicron surge.
A few 100,000 people, at least in the state of California, could end up with profound residual disease that's having a big impact on their day-to-day life.
Those living with long COVID told lawmakers getting care is a struggle. They called for more access to treatment, more research, and said those with long COVID-19 should get the protections provided by the Americans with Disabilities Act.
For me, the scariest part of all of this is that we have no idea what the future may hold.
More research is in the works. State leaders are keeping an eye on UCLA's INSPIRE study, a project funded by the CDC to study long-term health effects of the virus. Dr. Joanne Elmore is a principal investigator on the project.
There's basically this information void. It's kind of like a perfect storm. Patients and their families are anxious and suffering. There's not adequate support for the healthcare providers and the health system. We would like to see more patients. We don't have capacity. And we need to support collection of higher quality evidence.
Long-haul COVID could impact more than just the people it infects, but also the workforce. The Mayo Clinic's COVID rehab director told lawmakers an estimated 2.4 million Americans may not be able to work because of COVID disabilities.
I am worried that we're going to be facing a tidal wave of patients unable to return to work for a prolonged period of time due to long COVID. And I really fear what this may do to our world as we know it.
Lawmakers did not take specific action in Wednesday's hearing, but could take the information to create new policies. In Sacramento, Ashley Zavala, Fox 40 News.